Welcome to MedAxiom HeartTalk, where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom HeartTalk starts now.
I'm Melanie Lawson, host of MedAxiom HeartTalk, and today we are talking about cybersecurity in the healthcare industry. And we are being joined by Andy Tomaszewski, Director of Strategic Consulting at Google. Thank you so much for joining us.
Thank you for having me.
Well, we want to talk first about what are some of the most common types of cybersecurity attacks that the healthcare industry faces now. There is so much data that is being collected, and they are commodities.
Yeah, I think in terms of healthcare, what we're seeing, is, especially in 2024, is ransomware is running the race and winning the race this year. So we've seen major healthcare outages in the U.S. directly resulting from ransomware. That's not to say some of the other types of attacks aren't occurring, but the most impactful events have occurred because of ransomware attacks.
Yeah, and that's scary, as a patient to think that, because you have a lot of my data. You have my social security number most times. You have my health information, my address, a lot of information. So that really does make hospitals vulnerable and really primed to be a part of this attack.
You're absolutely right. The other thing about healthcare is there's such an interconnected group of providers within the healthcare industry. They're all connected all the time. And when a ransomware attack occurs, typically what happens is the internet cable gets pulled from that firm and all those connections just disappear right now and nothing's transmitting. And for large healthcare organizations, those number of connections can be in the hundreds, multiple hundreds. And everybody's wondering, why did the lights just go off and why can I no longer fill orders into the pharmacy, process radiology requests to radiology, get the lab results back? It all goes down, and the end result is the patients are impacted.
Right, and I mean, it's scary because that is life and death sometimes, getting that information, getting that prescription for patients, so that's so important. What would you say are the three most critical questions an organization should be asking when discussing cybersecurity?
I think first and foremost is the board aware? Is our leadership aware of their responsibilities as it relates to risk management and the role that cybersecurity plays inside of risk management? Many times we see that the board might not have the composition or the competencies to understand cybersecurity and the impact of cybersecurity. And by having those types of people in your boards, contributing to your boards, training your boards on cybersecurity issues, they can really get ahead from a leadership perspective and allow the leaders to make risk tolerance decisions for the organization.
Let me ask about that, because I think about where I work, and there are a lot of trainings that I do just as a peon, at the bottom of that. So I imagine you're talking about leadership, and then that trickles down to every single individual in that organization.
That's exactly right. So if we start with leadership and we train the leadership, they can take a top-down approach to disseminating it and making sure that the message is appropriate as it trickles through the organization. One message for one level of leaders might be different than for individual contributors within the organization, so that those people can actually perform their jobs.
Right, and what everyone needs to know and what maybe they don't need to know based to be able to work effectively. All right, number two.
I think number two is disaster recovery and business continuity is another major issue that we've seen. It seems like there was a push maybe 10 or 15 years ago for organizations to prepare disaster recovery and business continuity plans. And most of those plans were based on weather-related events. So if there were a hurricane, if there were a tornado, what would happen? And they all assumed sort of a sequential recovery type effort. And ransomware is entirely different.
Yeah.
All of the lights go out immediately. All the systems are down at the same time. And you've got to decide, which system are we going to bring up first? And how are we going to know that when that system's brought back online, it doesn't still have the malware installed inside of it and it's clean and it's ready to use? In healthcare, that becomes really tricky because there are so many specialized applications and services. Like if you think of a pharmacy within a hospital, they've got a system that fills orders and provides the prescriptions to the patients. Well, to bring that system online, that can't be done by IT alone. Right. It typically needs a vendor who made the system. It might need the lead from pharmacy who's authorized to say, yes, the system's working. It might need technical folks to bring it back online. it's a very complicated process to recover from those events. And a lot of times the disaster recovery and business continuity plans don't have assumptions for ransomware built in them. We help a lot of clients fix that, and so that they have recovery environments and recovery plans that account for ransomware type recovery.
Just thinking about that, like you're saying, it's so complicated. A plan like that, how long does it take to kind of come up with it? And I guess you're working through all the tentacles, and everyone has to be involved in that ground floor meeting.
That's exactly right. So when we respond to incidents, our hope is that that's pre-prioritized. And a lot of times we help companies pre-prioritize the list, plan it out, and even tabletop the recoveries to see if it's going to be successful, if it's not, before an event has even occurred. Other times we show up for incident response and that might not be there, and we have to build it on the fly when we show up, and we do that quite often.
Yeah.
It's
because
very
people
difficult.
don't have that
because they haven't done the pre-planning.
That's a lot harder, I can imagine, than doing it before you have an issue.
It's very difficult, and there are a myriad of issues that leaders have to decide on, like should payroll come up first? Should the patient check-in system come online first? What should be the first thing to come online? And it really reflects the values of the organization at that point in terms of making that prioritization. Finding those people to make those decisions on the 4th of July at 1 a.m. in the morning is difficult to find them, to ask them those questions so that we can restore those systems in the order that they need it to be done. So we love to pre-plan it out so that it's less disruptive, not only for the organization, for the patients, but also for the teams that are doing the recovery work on the back end.
You know, and I think too, you know, since we are patient-centered, you know, how that happens and how it looks and the messaging is so important because everyone's watching. You know, they're like, this affects me, which means it affects thousands of patients. And they're like, how am I being affected by this? And how quickly are things rebounding? Exactly.
And that's another reason why we love doing tabletop exercises. We want people to see that we're testing, that we're looking at it, that we're trying to find failure points before the failures exist, that we're creating the procedures, that we're testing the procedures, that we're following the procedures. Because then when an incident does occur, our constituents, our stakeholders within the organization know that we attempted to test this, we made changes, and we've communicated that all the way up to the board about the preparation activities that we've already conducted.
Yeah, I do. You may not be able to answer this, but I'm curious. It's obviously something you hope never happens, but how likely is a ransomware event? How likely is that it could happen to our local hospital?
Well, right now, based on the data that we're seeing for 2024, it seems like healthcare is a target for the ransomware threat actors. They typically go after organizations so that they would pay a ransom. There are many times where what I like to describe with ransomware actors is it's really multifaceted, where one group of ransomware threat actors will create an initial foothold within the organization. Then they'll determine who it's of interest to, and they'll sell that access to another group of threat actors who have interest in that specific organization, who will then go harvest the data, encrypt all the systems, and then extort for a ransom.
So this starts way before you start to see the impacts of it.
Way before you start to see the impacts of it.
Wow. All right. You got a third one for me that people should be thinking of?
I think the incident response readiness. You know, we talked about some elements of that, like doing tabletops, having an incident response plan, testing your incident response plan, testing your disaster recovery plan, having your asset inventory ready and available, having the asset inventory offline, because if the systems are all offline, you're not going to be able to access that document, so storing a copy of that offline so that we know how many assets we do need to recover, where they're located, where are the critical assets, and what are all the components that make up an application.
Yeah, it really does sound daunting, but it is true that if you're prepared on the front end, it's a lot more difficult to recover in these situations.
Yeah, and the way that we like to talk about it is likelihood and impact. We can reduce the likelihood and impact by testing, by proactive measures, so that if the event were to occur, it's not holistic, affecting the entire system. Maybe it affects a component of the system or the least important component of your business as opposed to the crown jewels of your organization. We want to make sure that those are protected and those remain online.
Andy, thank you so much for joining us. Great information for our viewers today.
Thank you very much.